everyone, thanks for tuning in to Shannon and Veronica Know Everything. Today we're going to be going through scrotal disorders. So we have 5 scrotal disorders that we're going to talk about. The first one is going to be spermatocele. So spermatocele, you're going to feel this on top of the testicle. Patients say they feel like they have a third testicle, so it's going to be a little bit superior and you should be able to differentiate it completely from the testicle. It transilluminates, so say your friend thinks they have one. Not to say diagnose your friends, but you could take your flashlight, and if it transilluminates, you could be confident that's a spermatocele or hydrocele. So it's like a third testicle. With spermatocele, it's pretty benign. There's an option for surgery, but it's not really necessary, so kind of just tell patients it might go away eventually. So hydroceles. Hydroceles are pretty obvious, I would say, from having seen them. It's going to be basically a huge enlargement of the testicles. This also transilluminates, so if your friend has a hydrocele, you can go take your iPhone, kind of look up there in the dark, and the flashlight should show it. In children less than 2 years old, there is, in the tunica vaginalis, there's an os, an opening that should close by 18 months. In some kids, this doesn't close, and then they'll end up with a hydrocele. With them, you're pretty much going to want to watch and wait, and it should go away. In adults, a hydrocele is generally going to be after trauma. So if there is a vignette that someone was playing soccer, blah, 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 injury to their balls, and then they develop a lot of swelling, hydrocele. This should go away over time. If it doesn't, surgery. What's wrong?
It doesn't ever go away spontaneously.
It doesn't go away spontaneously, but doesn't it decrease over time?
I don't think so. Because if you do,
It doesn't go away spontaneously, thank you. Okay, so a varicocele. A varicocele is in the pampiniform plexus. If you feel this, it's going to feel like a bag of worms in the varicose veins, which is like, you know. So it's commonly on the left side. There's a couple there's a couple theories for this, but the main theory is that we have testicular drainage on the left side, something about the renal connection, and so the vasculature there makes it more prone to kind of backing up. And it can also affect fertility. So most of these things are pretty benign, but know that a varicocele can affect fertility. And it can also lead to testicular atrophy. So this is one of the indications for treatment. If someone is noticing this, then you're going to want to go do more care. One way to confirm that you have a varicocele is that you'll lift the patient's scrotum up, and if the varicocele somewhat disappears, then that can confirm your diagnosis because the vasculature is going to drain back into the body. Okay. And then the next one we have is just an infection, epididymitis or orchitis. Orchitis is an infection of all the testicles. It's less common. Epididymitis is an infection of the epididymis, the structure that sits on top of the testicles. Why are you laughing? That sits on top of the testicles, and that is where sperm mature. So if you have a patient less than 35, you can reasonably conclude that they have an STI, whereas if your patient is 35 or older, you're more thinking that this is an infection, probably from E. coli. So this is only one where they're going to have a fever, pretty severe pain, very, very obvious that it's an infection. Friend sign, I remember don't let your friends get epididymitis. Friend sign is when you lift the scrotum up towards the pubic bone, the pain is going to be reduced. So not to be confused with the maneuver in varicocele. The varicocele disappears, whereas the epididymitis, the pain is going to be reduced. And then last but not least, we have torsion. So this is twisting of the balls, and it's going to be a sudden severe pain, can often occur when someone's sleeping. So a big thing of this, you have to confirm it with a Doppler ultrasound to see that it's really torsion. You'll see that there's no blood flow. So if you do not reduce or detorse in 4 to 6 hours, the balls are going to get necrotic and die, so it's very important. So just remember the tour is 4 to 6 hours, so you can manually detorse or go in surgery. Surgery is probably better, but some providers are able to and have the skills and knowledge to manually detorse, so if you can do that and say you're in a rural clinic, I think that would be a great option. So to review, today we went through scrotal disorders. Spermatocele and hydrocele, they both transilluminate. Spermatocele is like a third testicle. Hydrocele, you have to differentiate between children or adults. Varicocele is like a bag of worms. Epididymitis is an infection. And torsion, make sure you detorse them 4 to 6 hours. Thank you.